Welcome to Women's Health Minutes, a podcast series brought to you by the American College of Osteopathic Obstetricians and Gynecologists. The opinions expressed are those of our speakers and may not reflect those of our sponsors. This podcast is not intended to replace professional medical advice. We hope you enjoy our presentation today. Thanks for listening.
Hello, welcome everyone for another episode of our podcast. I'm delighted and really excited about this one. We have Dr. Ron Librizzi and Dr. Jeannine McMahon with us talking a little bit about career trajectory and retirement. And we're all friends and know each other, but could the two of you introduce yourselves for the audience and kind of where you're at in your career?
Sure. I'm Jeannine McMahon. I'm a general OBGYN, actually just doing obstetrics right now. I was in private practice up until 2017, at which time I transitioned over to be a laborist only. So that's where I am in my career. I'm currently 66 years old and considering retirement in the next couple of years. So that's what I'm doing now.
Great, Jeannine. I am a retired maternal fetal medicine person. I worked in high-risk pregnancy for 45 years. And then, there's some things you don't have control of in this life. And one of them for me was the trajectory of where medicine was going. And at 73, I decided it was time to start thinking about doing all the things I love, but not getting paid for them. So that's one of my definitions of retirement. And one of the things, because if you've been doing this for a long time, you don't want to give it up. You're scared to give it up. Right. So the very easy answer to that is you can do it. So not that I'm practicing on a patient's one-on-one, but I'm advocating for one of my passions, which is recurrent pregnancy loss. So being an advocate, I speak, I keep very busy with it. Like I said, though, the biggest difference is you're not getting paid for it now, like you did when you were working.
So there's a lot of ways to go and kind of questions that we're going to talk about. But since you mentioned some of the advocacy work and reproductive pregnancy loss you'll do, I'll just start with one thing that I know I've heard physicians mention, and that's when you get towards retirement and think about it, that some people kind of feel a loss of, like, what's my purpose? Like, I'm a doctor, I take care of patients. So tell me, like, how you kind of bridge that and approach that as you were getting to retirement?
Well, it was pretty easy for me to be able to take the thing I was passionate about and knowing the people nationally and now internationally that were involved with this. I'm going to tell you something. The age of volunteerism is over. So if you're going to volunteer for something, they're going to pick you up with it. So there are, and the person that I admire pretty much the most in this transition has been Lee Irving. Lee Irving is an OBGYN, retired, that works for a group called Volunteers for America that was started by a pediatrician in Hilton Head Island for underserved population. So Lee is doing his OBGYN, not getting paid for it, but also, on the other hand, there's a lot of the concerns that we've had. One of the biggest concerns we have, malpractice insurance, the whole issue. And Volunteers for America have that worked out in South Carolina, and now they are nationwide. So there's places for OBGYNs to go. And it's not just OBGYN, it's all aspects of medicine. And Lee spoke at our college meeting several years ago to talk about it. And I was on a call with him the other night, and he's still seeing patients 3 days a week and having a ball.
That's great. So one thing that probably the biggest factor or a large factor for one retires is being financially sound. And can you give some thoughts on that in terms of what's the strategy that you employed or you would advise in terms of kind of getting to that, or how you figure out how much one would need? All of these are things that people think about and wonder.
Well, yeah, I know for myself, something that Ron and I talked about, you think you're set for retirement and then something happens. For example, I got divorced after 30 years. So my retirement nest egg that I thought I had basically got cut in half. So I think one of the things that you want to expect the unexpected, or, as Monty Python said, no one expects the Spanish Inquisition. you have to prepare for the unexpected events in your life that, maybe you never saw coming. So that's one of the things. And it's, it's different for every individual. Everybody's circumstances are different. Some people have children, some people don't. You have to plan for education and things like that. And when you get out of your residency, because you kind of deprived yourself for so long, I think everybody wants to go on that expensive vacation and buy that expensive car and spend some money. And it's great to enjoy yourself, but I think you have to also plan for the future and, put away as much money as you possibly can without, depriving yourself completely, but just, feel like you've got enough money set aside that when you do retire, you can say, okay, I have enough to live on. And, things you have to take into consideration as far as how much is enough for each person. Of course, it depends on your lifestyle, but also things like taxes and IRMA, which for younger people don't understand Medicare, and that if you bring home a lot of money, they charge you more for your Medicare. So those are things that you have to think about. Well, my Medicare is not going to be $200 a month. It's going to be $700 a month because of my income. So you hopefully you have a good financial advisor and somebody who can walk you through a lot of these steps. I think that's very important too, is to have a good financial advisor.
Well, I think you did a great job of being Rupesh. You could end up taking that and using that as the podcast, because Jeannine's absolutely right. I mean, any way you look at it, finances are the most anxiety-provoking aspect.
Yes.
To the whole aspect of it. Not getting that paycheck every 2 weeks or whatever you do. That's a real eye-opener. And Jeannine, I don't know if we wanted to expand on that, but it's scary to think about, and it's scarier going through.
Yeah, unfortunately, I'm still working and getting that paycheck. We only get paid once a month, but that paycheck is still coming in. And I do, every time I think about, I think maybe it's time to retire, then I think about, oh my gosh, that paycheck's not going to be there. And it is anxiety provoking. Even though talking to my financial advisor and he assures me that I have plenty of money and I'll be fine, it's still that, it's a little nerve wracking. But, the thing is, I'm still working because I enjoy what I do. So, I'm working. Yes, it's nice to have the paycheck, but I still enjoy what I do. And even if, once I start collecting Social Security at the ripe old age of 67, I think I'll probably keep working as long as I'm healthy because I do enjoy it.
I'm going to ask you a little bit, Jeannine, just about how often are you working? Because I know that more years ago, there would be the model of, I would see physicians in practice, and then they would be a hospitalist or a laborist kind of transitioning, kind of like you did. Now we do see some that go into it right out of training and are doing it at a younger age as like their primary career. How do you balance that in terms of like, are you doing it full time, or is it something you're doing part time, or is that something you may also transition around?
Well, for me, it's part time. I never wanted, once I finished my private practice at the end of 2017 and started this only in 2018, I worked maybe 5 or 6 shifts a month, and I stayed part-time for my personal reasons were that if I went full-time with the hospital, then they would be able to tell me how much vacation I could take, when I could go, things like that. And for me, I wanted to be able to say, no, I'm taking off the whole month of January. I'm not going to be here. So for me, it was a personal decision to work part-time, and I'm probably working 5 or 6 days a month. Now, last year, because I'm crazy, one of our sister hospitals asked myself and one of the other doctors if we could come down and help them with some of their laborist shifts. So starting about 8-9 months ago, I started working at another hospital, a couple of 24-hour shifts a month, which I'm getting to the point where I want to give that up now. But just working 5 or 6 days a month is kind of nice. Helps me keep my skills up, helps me stay involved, gives me socialization, and it's not taxing. It's not taxing. And the paycheck's there.
Right. Anything you have, Ron, about financial tips that you would say?
Finances is number one on my hit parade, but it's second also to the anticipation of retirement. When I gave the Barbara Hawks lecture back, and this is for those who don't know, this is usually given to graduating residents who get certified and they're in the beginning of their career. And I'm talking to them about after you get all the celebrations about this, start thinking about retirement. And my father, who was a tailor, I mean, he made I remember vividly way back when he made $100 a week. And he used to say to me, I don't care if you're a trash man. He says, if you're making $3 a week, put one of them away. And that was kind of one of the things that stayed in my mind. So I always wanted to end, and then you heard people say, don't pay yourself first. And if it wasn't for my partner, Rob Bolognese, I mean, when I went into practice, we had the opportunity to join a retirement program at Penn, which you had to end up contributing to get to it. And I can recall vividly, I had 2 kids at that time. You know, for making the $24,000 a year back then, it was a stretch. And I said, I can't contribute to that. He says, Ron, you have to. So he guilt tripped me into doing it because he paid my first year for me. And then all of a sudden I'm in this thing now. And it's the best financial move I could have ever made, because that's the mainstay of my retirement finances that came after working for 45 years. So it was absolutely blockbuster to be able to get that started at that point in time. And if it wasn't for him, I probably said, oh, I'll do it next year. You'll put it off, you know. And so the financial thing is a big one, but you really help yourself out tremendously if we talk to youngsters about this kind of thing also, about getting something started.
And I agree 100%. It was the same thing with me when I started in private practice with Ron Rosenkrantz. He had a SEP IRA set up, and we just donated directly to that. And he said, you got to get into this. Just get going. That's going to be part of your, your perks from your salary. I said, okay. So we put away the max we could every year through the practice, through that SEP IRA. And yeah, that made a world of difference. And again, that is the biggest chunk of my retirement right there.
It makes tremendous amounts of sense. And I would have never known about that kind of, pushed into it.
The old saying about, compound interest, it's amazing. If you start putting money away at a very young age, by the time you're ready to retire, there's going to be a whole lot there for you. Yeah.
Yeah. I'll just add my 2 cents on it. I think you both said it brilliantly, is that, and I received the same advice. And so a SEP IRA, because I learned about some of this stuff over the years, is more for a privately owned corporation. If you're an employed physician, you have the 401ks, which you should absolutely maximize. And I think under 50, it's around 18 or 20,000. When you hit 50, I think you can put up to 30,000, and it's pre-tax, so it lowers your taxable income as well. And that's kind of a no-brainer that everyone should do at a bare minimum. And I think that's important.
Yeah, it's a no-brainer, Rupesh, but the fact of the matter is that there's always something you can figure out. Oh, I'm going to use this money for this, or I'm going to use that money for that.
Yeah.
So you really have to end up being really rigid about making sure you're putting stuff away.
And the other thing that I've worked at a few different hospital systems is that a lot of them, if not most of them, will do some amount of match. So they'll throw in 3 or 4% or a few $1,000s on top of it, which again gets compounded over the years. So it's really one of the simplest and easiest things to start with. I'm going to go into the next question, which I had, which was that kind of like, we know you retired at 73 and Jeannine, you're still working. I've seen physicians retire in their 50s and in their 70s, and some are happy and some end up going back to work. I had a partner who retired and he was like 73 or 74, and he would retire, and they had a 90-day, for some reason, a 90-day requirement. You couldn't unretire. So he'd wait 90 days and then he'd come back, unretire, then he'd work. I don't know why he had to officially retire, but he was doing this at like 73 or 74. For those that don't know, my father was a practicing ObGyn, and he retired at 73. And for like a while, I would say, why are you working? Why don't you retire? But for him, he worked part-time the last 10 years, and it gave him a little bit of structure, and he enjoyed it. He was doing maybe 20 hours a week, 4 or 5 half days, and it got him out of bed, got him to the hospital. So just both of your thoughts on that. Maybe since you haven't done it, like what your thoughts or advice would be if somebody was contemplating doing this at, say, a younger age.
Well, I think it's important to have something to do. And part of it, and I know it may be different for men and women, because I think a lot of times for men, being a physician is their whole identity. It's who they are. If they don't have any kind of hobbies, like Ron doing his search and rescue, a lot of people don't have that type of thing. So they just think that, okay, I'm going to retire. Now what? You have to have something to do. And I think for a lot of women, because they're used to running households and things in addition to being physicians, they know, okay, I've got things to do once I quote unquote retired. I've talked to so many women physicians that have retired and said, I'm busier now than I ever was when I was working. So I just think it's important that you have something planned to do, whether that like volunteer work, like Ron said, or a second chapter in your career. I said, I always wanted to be a travel agent. I missed my calling. I should have been a travel agent. So there are times that, like, when I have free time and people say, hey, I'm thinking about doing a vacation here, I'll say, oh, let me help you plan that. And I just like doing that, like helping out, just to have some kind of a hobby or some kind of something that you enjoy doing instead of just like sitting home and watching the snowfall.
Oh, you hit the nail right on the head, Jenny. The issue that comes up is we have all been hypomanic throughout our entire career, and all of a sudden when it stops, I mean, there are my rules that I talk about when you're thinking about retirement. You got to think about what are the things that you always wanted to do, but you didn't have time to do it. So you make a list. Next time I'm going on vacation, I'm calling Jeannine so she can set it up for me. But there's no limit to what can be done. And so that's how I ended up looking at keeping myself busy. Because the fact of the matter is, the other thing is, in my particular instance, and I think for a lot of guys who retire, who are in a happily married situation, you think that you got to stay out of the way of the real CEO of your household.
Yes.
You can't wake up every morning and say, oh, what are we going to do today, dear? Because she's got things to do. She's had this life alone and not had to worry about having anybody on the board of directors. And so if you ask her, you want me to go shopping with you? No, she doesn't want you to go shopping with her. But the fact of the matter is, sometimes she won't say that. But the fact of the matter is, you got to find things on your own. You can't depend on other people. And I tell you, I have several friends. It makes me very sad when I hear them say, I should have never retired, or I'm bored. You got to take the bull by the horns and figure out what are you going to do when you retire, and then look forward to that kind of thing. I love the water. That's what I could never be in the Coast Guard if I was working. But the fact of the matter is, as soon as I got out, I got into it with a vengeance and loved it. And so between that and then the advocacy group, that I went from Dr. Ron to Uncle Ron, but at least I could end up being able to work in that environment. That keeps me very busy. And you do it for as long as you can do it, because the other major issue that's on your tick list is your health. You got to keep yourself in good health. You got to be able to keep. So, if you're going to wait till 70 to stop smoking and drink less and this, you're way over that. But your health is so important to be able to do some of these things that you could dream about. Real estate, vacation planners have to be in good health. So no matter who you are, that's the thing. So yeah, you can't just figure out that, I'll do something when I retire. You got to think about it, because then you anticipate it. And when you anticipate that, it's like going on vacation. You can't wait for it to come.
Right. I'll say that for those that don't know Ron, is that when you see him, he's got the energy of somebody who's 20, 30 years younger. And so I'm going to ask, give us some tips on what do you do? Because it's I remember the time I saw you in California at a conference. It wasn't that long ago, and I had finished a run and you were out there yourself running. And this was maybe 10, 12 years ago. So tell us some things that you would recommend for people, because doctors are the worst patients, as you know.
I'll start out with the fact that I started out life as a fat little Italian kid, realizing that the way I could make my mother happy was to eat. She put it on the table. I ate it. She was happy. I'm a happy little camper. But then all of a sudden, closing in on 300 pounds as I get into high school, and say, look, I got to figure out something to do. So there were friends of mine who said, why don't you just try to go out and run? I said, run? I said, that never crossed my mind. But the fact of the matter is, it was important, because what happens, I ran a little bit. Then I used to say that, why am I running? I'm running so I could have dessert tonight. So all of my bad eating habits were helped by running. I had migraine headaches, couldn't get rid of them. By running, it acidified me, and all of a sudden. So there were benefits that I got very early in life that I'm afraid not to do that now. Nobody would end up ever thinking that I really am running. I'm not running. I'm not jogging. As a matter of fact, your tracker, my running tracker. I finish my workout and it says, I hope you enjoyed your walk. That's how slow I am. So the issue is that you do what you can do, but you got to keep moving. Older lady had beat me in tennis one year. She said to me, I says, how do you keep yourself in such great shape? She says, if you rest, you rust. And she's absolutely right. So she says, throw the Barco Lounger out. I hadn't heard Barco Lounger in years, but you throw that out and just keep moving. And that's it.
Well, and I agree with that also. You know, I grew up as a skinny Irish kid, but I got heavy as I got older. It's one of those things, all of a sudden you're working and you have a few dollars in your pocket and you've worked all day and you think, I don't feel like cooking dinner. So we used to go out to dinner, 5 nights a week, and the other nights we'd order pizza. So I'm not much of a cook, so just so you know. So that's one of the things, is you're so stressed out and working so hard in your career, it's easy to put on the weight and very difficult to take it off. What I have found as I've gotten older, I actually joined the Y a couple years ago because one of those things, to try to open a pickle jar and I couldn't. And I thought, okay, I'm not going to be that weak old lady. So I forced myself to go to the Y, and they have, like e-machines, like exercises for older people. And in addition to that, I probably walk 2 to 3 miles, like 4 times a week. So yeah, so I have a friend who says, well, you're fat, but you're fit fat. And I said, oh, thanks a lot. So, just because you're heavy doesn't mean you can't be healthy. So.
Absolutely right.
Yeah. For those that don't know, like, I'm a runner, but I probably didn't start running till I was close to 40, and I've run like now maybe 20 half marathons or so. But again, you can start at any age, and it's really just staying moving. And I think, I don't remember the stat, but I know they say you lose something like 3% of muscle mass like every decade after 40 or something. So Jeannine mentioned like lifting weights and like all of that stuff, like it helps. And I think one thing that was on my mind when we were talking about this podcast was about retirement. And I know I have a friend of mine, and he said, I remember this story when he told me that his parents were, his dad was going to retire. I forgot what age it was. And like a month before, like his mom had a stroke. And it's like, so my point of that is, like you both mentioned, you can't predict things, you can't predict catastrophes. And I guess it always made me think, well, you also can't years from now predict that you're going to have all these things too. So it's always been, to me, a little bit of, don't save everything on that list until retirement. Is right. You all know those workaholics that work too much, and that stresses them out, and that actually affects their health. And so it's really trying to have that balance of, if you've got that wish list, knock half of it off before, because you're not going to get to everything you want, or you might not be in the physical shape you want when you retire.
Right.
Well, that's what I said earlier when I said, when you first get out and you have all this money, enjoy, but plan. So you can enjoy some of those things. And, I was talking to my financial advisor several years ago, and he said, so as you get older, you're going to have your go-go years, your slow-go years, and your no-go years. So in your go-go years, you spend the money, because then as you get a little bit older, it's not going to be so easy to get around anymore. And then there's going to come a time where you probably aren't going to get around at all. So enjoy it while you can.
That's good advice.
Yeah.
Well, this has been such a great discussion, and we're not going to have time to complete this today. So please tune in for our follow-up episode where we continue the discussion. And remember, please like, follow, share the podcast, and spread the good word. See you all next time.
Thank you.